Hi, everybody. This is Casey Weaver. I'm one of the Peds ED nurses at St. Agnes, and wanted to go over a couple of things with everybody. We've revamped our past medical history screen, so we're going to be rolling that out soon. Currently, we're going to be tweaking our current intake process for pediatric patients after Quick Look. This is things that some of us already do currently, some of us don't. So just as a reminder, the patients are quick looked out front, and then they go to vital signs to get the vitals obtained out there if the patient's 2 years and older. When it's super busy and or super short-staffed back here in Peds, you can always call out to the front to the quick look nurse and ask them if the tech would be able to obtain vitals on all the patients over 3 months of age out front. It does save some time back here for the nursing staff. Neonates will always still need to be done fully back here by the nurses. Once the patients are already intaked, they should be taken direct to bed to complete the triage process back in the back, if beds are available, or done in the waiting room if the chief complaint allows and the family is amenable to discussing their child's issue in the waiting room. Otherwise, they can be brought back to room 208 and then returned to the waiting room or a bed, as we've always done. If beds are available, there's no reason to create an additional stop in room 208, so please, everybody, try to go direct to bed if possible. The next thing that we want to try and focus on is when it's busy, please do an abbreviated intake if you're acting as the triage nurse here in the back. As the triage nurse, we need to complete just a couple of interventions in the triage area. It's past medical history, sepsis screen, if it applies to the chief complaint, and one focused assessment, and allergies. All the other interventions can be completed by the patient's nurse later in the visit. That includes pain, labs, diagnostics, comfort measures, learning, communication, and additional focused assessments, etc. Our goal as the triage nurse is to get the kids in the waiting room seen and triage and protocols initiated as soon as possible. The changes that I'd like to show you guys on the past medical history are what we're going to go through right now. Pretty excited about these because I think it's going to make it a lot more user-friendly and should be a little bit quicker for us to get through as the triage nurses. Always check off who you get the history from, as we've always done. The big change to this is that all the mandatory fields have been asterisked. As you can see right here, allergies, confirmed yes. Cardiac, respiratory, endocrine, all of these asterisk fields have to be addressed, but there's no more guessing as to which fields you have to do, which ones you don't have to do. All of these fields down here, cancer, radiation, musculoskeletal, these are all things that we don't have to fill out unless it's applicable to the patient. Then it will drop you down to LMP, and these things are down here as well. The smoking fields all do still have to be filled out. However, we weren't able to fit asterisks into all of these fields due to character count constraints. So those are the big changes on this screen. The other thing that's new, and probably the most exciting with this, is that if a patient comes in and they don't have any medical problems, you can do allergies and click on no past medical history. That did that fast. But when you do that, it bypasses all of this and automatically drops you down to the LMP field. If the patient doesn't have that, then you can continue on to the smoking fields and address those as well. There's still a lot of descriptor text in all of these fields, but we weren't able to eliminate that for a number of reasons. So I hope that this helps move things along and make our triage process a little bit faster back in the back. Thanks.